Your commencement speaker today is Dr. Richard Veith, Western Washington University class of 1969. Richard Veith is a physician, psychiatrist, administrator, and professor at the University of Washington School of Medicine. There he is the chief of Psychiatric Services at the UW Medical Center, an adjunct professor of global health in the School of Public Health, and the Richard D. and Bernice E. Tutt Professor in the Neurosciences. He was a longtime chair of the UW Department of Psychiatry and Behavioral Sciences and served as director of the Geriatric Research, Education, and Clinical Center for the Seattle VA Puget Sound Healthcare System. He also serves as the national chair of the Department of Veterans Affairs, Geriatrics, and Gerontology Advisory Committee. Dr. Veith has published extensively on the treatment of depression in patients with heart disease and stroke. He is also active in telemedicine, helping to lead a 4-year grant to improve the delivery of mental health care and pain management services to rural Washington. Dr. Veith travels regularly to Vietnam and Cambodia, working with medical schools and health ministries to address the tragic shortage of psychiatric and mental health care in those countries. Thanks in part to these efforts, the UW now has a formal relationship with a medical school in Can Tho, Vietnam, with exchanges of students, professors, and researchers between the two institutions. Dr. Veith, whose grandfather was a physician in Yakima, knew he wanted to be a doctor when he came to Western and received a solid start in science and psychology. The rest of his medical training was at the UW, but he remains close to Western. He's one of 11 WWU alumni in his family, which received Western's Alumni Association Legacy Family Award in 2015. He and his siblings established the Barbara Ellen McGuire Scholarship in honor of their 91-year-old mother to support students planning careers in healthcare, neurosciences, or information sciences. Dr. Keith is a member of the College of Humanities and Social Sciences Advancement Council and also advises Western students interested in medical careers. Please join me in welcoming a distinguished graduate and friend of Western Washington University, Dr. Richard Veith.
Well, good morning. This is pretty wonderful. I want to thank all of you. I want to thank President Shepard, the trustees, the faculty, and you graduates for the privilege and the honor to join you today. I also want to echo President Shepard's recognition that it's the family and the parents and the friends who provided the support that many of you needed and sometimes the cajoling that some of you needed to get through to this day today. So let's thank them again for their support and encouragement. So at this moment, I stand between you and a big party. And as I'm fond of saying, I'm a highly trained professional, so it's not rocket science for me to figure out that I better be brief, and I will be brief. It's a perilous position to be in. So let me start by asking, how many of you read the book Outliers by Malcolm Gladwell? Can I see a show of hands? Some of you, yeah. Good. I'm going to echo some of the themes you've been hearing today already and hopefully illuminate them as well. There's really something interesting in this intriguing book for everybody. You will learn that it's not innate ability or genius alone that determines great achievement in life, but in fact a unique interaction of time and place when it is coupled with opportunity, talent, and it turns out to be 10,000 hours of practice that can create a world-class expert in just about anything. This formula explains, for example, why the very best baseball, hockey, and soccer players are born in January and February. Kind of intriguing. Why the Beatles were successful. It's related to that 10,000 hours of practice. And why Bill Gates and Steve Jobs were able to transform computing from mainframe computers to personal computers. I encourage you to read it because there's a special opportunity that each of you has at this precise moment in time in your life journey. And it's important to be in the right place at the right time. This is your place and this is your time, and I want to emphasize that. Your next 10 years will be critical in determining your unique position in life and your future. You will need to make these discoveries on your own, but I'd like to offer some advice based on my own experiences that I hope might be helpful. First of all, never give up on your personal aspirations and maintain a sense of perspective, a mindfulness of your place in time. I graduated from Western almost 50 years ago, which is a little scary. Where's my walker at this point? I need my walker. To think about. I'm a geriatric psychiatrist. I've spent my career working with older people, focusing on aging and Alzheimer's disease at one point. I've spent a lot of my clinical work talking to people about their lives, the narrative of their lives, some of which have been successful and some of which have been not, unfortunately. So I have an abundance of perspective. And then like Lonnie, who's talking about the future, I'm going to reflect back a little bit, but I think we're going to echo the same themes. Offering you this sense of perspective, I hope will be among the most valuable things that I can offer you today. This is a spectacularly wonderful milestone for you to be graduating from Western today, but even more valuable is what it says about you in the narrative of your own unfolding life. Yes, your degree will open doors that might not have otherwise been open for you, but what's really important is what this says about your ability to work hard, to persevere, and to exercise discipline. And it's these attributes that are going to make the biggest difference in your future success and, frankly, in your future happiness. It's important to recognize those things. Let me give you a case example. It might not be obvious from that lovely and gracious bio that President Shepard just read you, but I'll bet that my experience here at Western was very similar to many of yours. I attended Western in the late 1960s. Like now, it was a period of intense social change. There was a protracted war ongoing, and there was a lot of cultural disruption. As for some of you, paying for college was a struggle for me and my brothers and sisters, and events in my own family threatened to derail my dreams. As you heard, my identity was to be a physician. My grandfather was an early physician in Yakima 100 years ago, and I grew up with these unbelievable stories from my mother talking about him snowshoeing into the reservation in the dead of winter to provide care to the Native Americans. I also heard that, in fact, it turned out to be true because I read the obituaries, that 2 native Yakima chiefs in their full headdresses attended his funeral, which is a comment on how much he was valued. But at the time of my graduation from Western in 1969, my own dreams were in serious jeopardy. Unlike you here today, I did not attend my graduation. That's right, I did not attend my graduation from Western. So why is that, you might ask? Well, I'll give you the short version. I'm the second of 8 children in a classic kind of Irish Catholic family of the 50s and the 60s. But our self-view was shattered by the fact that my father essentially abandoned us when I was 15. We lived in Bellevue. He moved to Mercer Island, but we didn't see him for 3 years, and very infrequently thereafter through the rest of his life, actually. My mother was a homemaker and was overtaken, as you can imagine, by all the burdens of being a single mom with 8 kids, ranging from age 16 to 6 months, my youngest brother, who also was a student here. We were essentially on our own to figure out how to get to college and how to pay for it, as some of you have been, I'm sure. Now, granted, we were not homeless, we were not destitute, but it was a very precarious and a particularly stressful time for several years, actually. That was my first lesson in resiliency. And as they say, if stress doesn't kill you, it makes you stronger, and that's an important life lesson. My second lesson, actually big lesson, came around the time I graduated in May of 1969, when I received the last rejection letter from the medical schools that I had applied to. I was crushed, as you can imagine, demoralized and pretty lost, actually, at the time. And as you know, as a result, I didn't attend my graduation. I was really lost trying to figure out what I was going to do. Now, those of you who may not know, but 1969 was not a good time to be out of college. The Vietnam War was running, and there was a draft, and my generation was very, very preoccupied with the risks and significance of that. To give me a chance to reapply to medical school and to continue on my aspirations, I joined the Marine Reserves. I was sent to San Diego to boot camp, which was pretty rigorous back in those days, probably still is. I was the only college graduate of 400 kids who arrived that week in the recruiting group that came in that week, many of whom had come from the inner city and were highly disadvantaged. So it was an interesting cultural immersion for me. Luckily, I had been a swimmer and I was a runner and I was in good shape and relatively smart, having graduated from Western, and I survived and did pretty well. I was interviewed for medical school at the University of Washington the day after I returned from active duty. It turns out, actually, I can remember now, it was December 19th, 1969. And I was accepted on the spot, after the interview of a large group of people, which is very unusual then and now, actually. But thinking back, I understand. I was able to give a story about having put myself through college and joined the Marines to keep my aspirations in play, compared to the privileged smart alecks from Yale and Harvard, oh, did I say that, who were applying also at the same time. Of course they wanted to reward this young, hardworking, dedicated young man. So I was very, very blessed, actually. So I survived those two big challenges early in my life, and I had many years of hard work to follow and had what most would consider a very successful academic career. But frankly, I think my grandfather would be most proud of the fact that many in my family have not lost sight of the importance of giving back to the community and taking care of those less fortunate. I stepped down from my duties as chair of our department. It's a very large department, 350 faculty at the School of Medicine. Last year, my own next 10 years will be focused on efforts to improve training and access to mental health care in Vietnam and Cambodia, where mental health care is remarkably stigmatized, much more so than here, as a matter of fact. My brother Rob, who also attended Western, is an orthopedic surgeon who's been going to Vietnam and Haiti and a few other places for 15 years and has been regaling us with these amazing stories of transforming lives. Over there, if you're poor and you're Hmong and you're in the North Hill tribes, you're born with club feet, you end up going through your life with club feet. And so they're going over there and finding these young people, kids and young adults even, and turning them around so they're at least walking on the bottom of their feet. And it's just amazing transformations of these people's lives. I've learned in Cambodia that there's really no functioning healthcare system, despite in some areas tremendous wealth, at least in Phnom Penh. And it's still reverberating socially from the aftermath of the Pol Pot regime in the late 70s. And as you may know, they killed all the doctors, they killed all the judges, they killed all the professors and the intellectual elite and the artists, and they took everybody in the cities and drove them out into the fields. And in that 4 or 5 year period from 75 to 79, a fifth of the population was killed during the killing fields experience. I learned last year in one of my visits that as close as 90 minutes away from Phnom Penh, which is a big international city with skyscrapers and lots of assets, that there are actually disturbed, mentally ill patients whose villages can't manage them, so they're actually tied down and chained in huts underneath the houses. I thought this only happened in Africa. You may have read about 6 weeks ago a 2-part article about this in Africa, and I was appalled to learn this and just terribly troubled. So my next 10 years is going to be spent trying to help improve access to care, training, and destigmatize mental health care because it's really a moral imperative. So what's my takeaway message for you for your next 10 years? And I think this is going to be a critical time. I have a few suggestions. First, be mindful. Enjoy the moment. So for right now, really celebrate this wonderful achievement with your family and your friends. But stay focused and passionate about life and your dreams. Never give up. It's important to develop resilience. Life, unfortunately, can be hard, and it actually can be unfair. There are certainly much worse stories than mine, of course. I tell our trainees at the medical school, when we're working at Harborview particularly, where there's 67 inpatient psychiatric beds, when we're caring for troubled people from broken families who've been abused, neglected, or sometimes discarded, that the only difference from us was the family they were born into, through no fault of their own. It's really important to maintain that sense of empathy and recognition. Cultivate calmness in your life. In all the rush to succeed and live life fully, be thoughtful and deliberate in your words and your actions. You really don't want to be living the Jerry Springer show. That's what I refer to when we see really active families in our units. Those of us blessed to live here in this beautiful part of the world know that nature is a great source of calmness. Take advantage of it, but also take care of the planet. Focus on having love in your life. Learn to take good care of yourself and others. Be a great son, a daughter, sister, brother, father, mother, partner, and friend. How you live out these roles will provide a true sense of self-worth and meaning in life. Grow personally from exploring and understanding the perspectives of others, in your family, in your community, on your campus, and in the world. Immerse yourself in other backgrounds and cultures, and when possible, try to see the world and truly learn to respect and develop empathy for others by listening and understanding their perspectives. By this example, you can foster peace in your own life, but also peace in the world. It's very important to give back to your community, your university, those who follow in your footsteps. We are nothing without each other. And above all, maintain honesty and integrity. At the end of the day, this will define your character, your reputation, and your legacy. So my generation takes great pride in the fact that we challenge the status quo, we question conventional authority, and help promote societal change. But there is much more to do to create a safer, more enlightened, and more just world, as has been apparent on this very campus in recent weeks and any time you turn on the news and see what's going on in the world. There are incredible opportunities for you and your generation. Western is a wonderful institution that really has provided you the platform and all the tools you'll need to be successful. It's actually time for my generation to pass the baton to yours. I think we had a couple of decades in between there where there wasn't quite so much urgency, but I think we're back on a cultural time much like the 60s, and I think it's going to be your generation that we really need to count on. You are our future, so try to make the future be what you want it to be. Now more than ever, we really do need you to be successful. I have confidence in you and wish you every happiness and success, and I want to thank you for letting me graduate with you. And good luck to you all. Thank you.
Thank you, Richard.